Acute appendicitis. The vermiform appendix is considered as a vestigial organ by many. It is of great importance because with propensity for inflammation. Acute appendicitis is the most common cause of acute abdomen in young adults. Despite extraordinary advances in modern medicine, the diagnosis of acute appendicitis is essentially clinical. Appendix is a blind muscular tube found in humans, certain apes, and an Australian marsupial called wombat. It is found near the ileocecal junction and reaches its adult size by 2 years of age. The appendix is found in the retrocecal position 3/4 of the time. The pelvic position is the second most common. The other positions are pre or post ileal, para or subcecal positions. The base of the appendix is found at the confluence of the three tinea coli of the cecum, which fuse to form the outer longitudinal coat of the appendix. The appendicular artery is a branch of the lower division of the ileocolic artery and is an end artery, the thrombosis of which can cause necrosis of the appendix. An accessory artery was described by an Indian called Sesachalam. Isolated reports of appendicitis had been found in literature since the year 1500. It was formally described for the first time by Reginald Fitz in 1886. However, it was Charles McBurney who described the clinical manifestations. In the first half of the 20th century, about 16% of the Western population underwent appendicectomy, and the incidence had dropped in the last few decades. Infection with mixed aerobic and anaerobic organisms is important along with obstruction caused either by a fecolith or stricture in causing appendicitis. Intestinal parasites are sometimes responsible, while the rare causes include benign or malignant tumors. The symptoms are as follows. Appendicitis begins often as a poorly localized colicky abdominal pain. Murphy described the classical triad of central abdominal pain that later shifts to the right iliac fossa, anorexia, nausea and vomiting, along with fever. With involvement of the parietal peritoneum, sudden movement and coughing increases the pain. The children with appendicitis have complete aversion to food and always vomit and are not able to sleep. Most of the time, patients have a history of similar episodes of pain that settle down with treatment. Since appendicitis is such a common condition and diagnosis is primarily clinical, a variety of signs have been described. The pointing sign. The patient points to the McBurney's point, which is at the junction of the lateral 1/3 and medial 2/3 of a line drawn between the right anterior superior iliac spine and the umbilicus, as a site for severe pain. SHERREN'S triangle hyperesthesia. Hypersensitivity in the triangular area between the right anterior superior iliac spine, umbilicus, and the symphysis pubis may be a sign of gangrenous appendicitis. Barpett's bed shaking test elicits parietal peritonitis. BLUMBERG sign or release sign is a name given to the rebound tenderness that occurs while palpating the right iliac fossa. When the palpating hand is suddenly removed, there is severe pain. ROVSING'S sign is elicited by deep palpation of the left iliac fossa By shifting loops of bowel, this causes pain in the right iliac fossa. PSOAS sign and test. With retrocecal appendix, the patient lies with the right hip flexed for pain relief. This is the sign. To elicit the test, the right hip is extended and this causes severe pain. Baldwin's test. With the hand under the right flank, the patient is asked to raise the lower limb off the bed with the knee in extension. This causes severe pain in retrocecal appendix. Obturator test. When the pelvic appendix lies over the obturator internus muscle, internal rotation of the hip is painful. Perirectal and vaginal examinations could help in eliciting pain and tenderness in case of pelvic appendix. Although such a wide variety of clinical tests are available, most surgeons with experience decide by eliciting tenderness and guarding. These two features are not very obvious in the elderly, and the diagnosis is often delayed.